This is the mandatory online information session for the Physical Therapist Assistant Program at Mercer County Community College, and all applicants to the professional phase of the PTA program are required to watch this video. To receive credit for participating in this information session, you must complete and submit the PTA program information session participation form, which is located on our website right underneath where you clicked on this video. Within 6 business days of submitting this form, a note will be placed in your student planner portal indicating that you have fulfilled this requirement. To check to see this note, you're going to access your student planner, click on Plan and Register or Plan and Schedule, and then click on the Advising tab and scroll all the way down to the bottom to view the notes that have been submitted. If you do not see this note in your student planner 6 business days after submission, you can email pta@mccc.edu. In order to complete this form, you must be a Mercer student because the form does ask for your student ID. If you haven't yet looked at that form, I would pause this video now, click on that form, read the questions that are going to be asked so that you know what to look for. There are you have to receive at least an 80% on that form. 80% of the questions must be answered correctly. And you have an unlimited amount of times to complete it. So you'll submit it. If you don't get an 80%, the note in your student planner will indicate that. And if you do, the note will indicate that as well. But you have unlimited attempts to do this. Okay, so what is physical therapy? So it's therapy for the preservation, enhancement, or restoration of movement and physical function impaired or threatened by disease, injury, or disability that utilizes therapeutic exercise, physical modalities such as massage and electrotherapy, assistive devices, and patient education and training. Also called it's typically called physiotherapy in other countries. It's physical therapy here in the US. So there are 2 providers of physical therapy services in this country who can bill for physical therapy, and that is physical therapists and physical therapist assistants. So physical therapists diagnose and manage movement dysfunction and enhance physical and functional abilities. They restore, maintain, and promote not only optimal physical function, but optimal wellness and fitness and optimal quality of life as it relates to movement and health. They help to prevent the onset, symptoms, and progression of impairments, functional limitations, and disabilities that may result from diseases, disorders, conditions, or injuries. So the things that physical therapists can do that PTAs cannot do include examine and evaluate patients, create goals for the patients, create a plan of care, so determining which interventions will and will not be provided, doing a reevaluation and a discharge summary. But everything else PTAs can do as well. So physical therapists, the academic requirements in the state of New Jersey are that they possess a minimum of a master's degree in PT from an accredited college or university. That's because we've grandfathered in those professionals who have graduated before the entry-level degree turned into a doctorate degree. So currently, all PT programs in the state of New Jersey award entry-level doctorate degrees. That includes Kane, Rutgers, Seton Hall, and Stockton. And PTs must have successfully completed the written exam, which is the national board exam. The academic requirements in the state of New Jersey for a physical therapist assistant is that you have to have completed at least an associate in arts degree from an accredited college or university. So our college does fulfill that. You are awarded an Associate of Applied Science, and we are accredited by CAPTE. So CAPTE is the Commission on Accreditation in Physical Therapy Education. It is the entity that accredits all PT and PTA programs in the entire country, and we have been accredited by CAPTE since 1998. You have to have completed a 2-year PTA program from an accredited college or university, approved for the education and training of PTAs, blah, blah, blah. Yes, we fulfill that. And then you have to successfully complete your national board exam and pass that. So PTAs work as part of a team to provide physical therapy services under the direction and supervision of a physical therapist. PTAs implement selected components of patient-client interventions. They obtain data and they make modifications in those selected interventions, either to progress the patient as directed by the PT or to ensure patient-client safety and comfort. They also help the PT in the treatment of individuals of all ages, from newborns to the very oldest, who have medical problems or other health-related conditions that limit their abilities to move and to perform functional activities in their daily lives. So the PT is responsible for the services provided by the PTA. Although both PTs and PTAs are licensed healthcare professionals and therefore both have the potential to lose their license to practice, PTAs provide care for people in a variety of settings, including hospitals, private practices, outpatient clinics, home health agencies, schools, sports and fitness facilities, work settings, and nursing homes. And you must have graduated from a CAPTE accredited PTA program and be licensed or certified. Most states at this point provide licensure in whichever state you work. So where do PTAs work? So this is data from 2021. PTAs held about 96,500 jobs in 2021. The largest employers of PTAs were as follows: offices of physical occupation and speech therapists and audiologists, so that's outpatient facilities; hospitals, 24%; home health care services, 11%; nursing care facilities, 8%; and then physician-owned practices are 5%. Overall employment of PTAs and aides is expected to grow 24% between 2021 and 2031, which is much faster than the average for all occupations. In terms of daily work, PTAs are frequently on their feet throughout the day, moving as they work with patients and set up equipment. Because transferring and guarding the safety of their patients is a constant expectation, both PTs and PTAs are vulnerable to back injuries. I should say that this is mitigated by the education you get in our program related to no lifting policies and laws and proper body mechanics. Mercer County Community College has a well-established PTA program accredited by the Commission on Accreditation in PT Education since 1998. Our graduates earn an associate in applied science degree. They do walk in the college's commencement ceremony in May of each year, and they are eligible to take the national board exam for PTAs, which is the same exam regardless of which state you take it in. So PTAs who are taking their licensure exam in New Jersey or Pennsylvania, Florida, Texas, Idaho, they're all taking the same exam. So how is testing handled in the PTA program? Testing, course instructors may utilize the Academic Testing Center on the West Windsor campus. We oftentimes use our Blackboard learning management system, which means that the tests are administered through the computer. And then we have competency testing and practical examinations, which are both tests of psychomotor or hands-on competence. Competency tests take anywhere between 30 to 60 minutes, and they occur throughout the semester. They also occur outside of classroom time. And a practical exam is a cumulative test of hands-on skills that takes place at the end of each semester. So again, graduates are eligible to take the national board exam, which is the same in all states. Once you take the exam and you pass it once, you never have to take it again. So at that point, you can get reciprocity and practice in other states without having to retake that exam. At this point, I'm going to pause and we're going to go over to the program's website. So this is the homepage of the program's website, has our mission statement and our goals, information about accreditation. I'm going to click on this gold button over here on the left that says required PTA program information session. You must have already found this because you're already watching the video, which is up here. Down below, this is the info, the Google form that you must complete when you are done. All right, now on the left, we've got a navigation panel here. So I'm going to click on the top one, PTA program information. And here is program outcome data. So you can see our pass rate for the national board exam. You can see our employment rate, our graduation rate, and then information about each cohort. So that's outcome data that's available to everyone. The next little bullet down is for prospective students. So I'm going to click on that. The first bullet includes changes that took place in 2023. The next bullet talks about where you should begin. So if you don't know where to begin, you can click on this. It's kind of like a to-do list that you would complete in this order. The third one down is the information packet. So I'm not going to read this entire packet to you, but we are going to talk about the highlights. So there's a little introductory letter. This is, if I were to describe the program on one page, this would be it. And then we've got a link for our program website. We have 2 full-time faculty members in the PTA program. Myself, Professor Beinert, I'm the program coordinator, and Professor Talone, who's the academic coordinator of clinical education. If your last name begins with the letters A through L, technically Professor Talone is your academic advisor. If your last name begins with the letters M through Z, I am your academic advisor. It doesn't matter who you email, we will both respond to everybody, and our contact information is here. We do have a health profession success coach. He can help you to navigate anything related to pre-professional information. This is an at a glance. So at the left are the application requirements that you must complete when you apply to the program, and the right are your graduation requirements. Here's the degree requirements. So the pre-professional phase courses are English 101 and English 102, Psych 101, a math course, Anatomy and Physiology 1 and 2, a general education elective, and kinesiology. And then once you are accepted into the professional phase, you go through these gray highlighted semesters together as a cohort. Here are some sample course plans for prerequisites. There is no one right way to do it, and these are only 5 potential options. There are numerous options for how you can tackle your prerequisite courses. Here's information about complaints outside of due process, some recent changes that you might want to review. Okay, here's your step-by-step guide or your to-do list. So number 1, you're going to apply to be a Mercer County Community College student. It is free. You can do it in person or you can do it online. You will get a Mercer student ID and an email address. Make sure that you choose the correct major, which is health science for PTA. And then you're going to have any official transcripts from academic institutions where you have already taken courses sent to Mercer so that we can determine if there are any courses that will transfer for credit here. Then you're going to complete all remaining prerequisite courses. You're going to attend, which is what you're doing right now, the mandatory information session, and then you're going to submit an application for the professional phase during the month of April. Here's your statement of students' rights and responsibilities, which was taken from the college's student handbook. The next page is information about the application itself. So the application is open each year in the month of April, and it does include, the application is online, and it includes a writing skills assessment, which is completed in the West Windsor Testing Center. This next page has all the information about the writing skills assessment, including the grading rubric, so you can see exactly how these points, where they come from. Now, we do have a policies and procedures handbook that you will get once admitted into the professional phase, but for now, I've included those policies that pertain to prospective students in this packet. So the impact of pass-fail grades, transfer credit evaluation is here, our professional phase grading policy. So the college considers a C and above as passing. Once admitted into the professional phase of the PTA program, C+ is our minimum grade for passing. Not only do you have to earn a C+ in the course, but if it's a lab course, you also have to earn a C+ not only in the course, but in the cognitive domain, separately from the psychomotor domain. The next page includes our tuition and fee estimates. So you've got a row here for students who live in county, out of county, and out of state. There are some details about what costs what, including the lab uniform and lab coats. And then here's a breakdown of our course fee information. So the first column is the course, the second column is the fee, and the third column is how those course fees are utilized. All right, so this page gives you some information about the health records that are going to be required when you are a professional phase student. This includes an attestation that you have medical insurance coverage, CPR certification for a healthcare provider, first aid certification, a physical examination completed by a medical doctor, and that includes some lab results, as well as vaccinations, including Hep B, medical malpractice insurance, a criminal background check, and there might be additional facility-specific requirements such as drug test, flu shot, extra criminal background check, COVID vaccine, etc. We do not accept any exemptions for these requirements. More information will be provided once you become a professional phase student. So we don't encourage you to complete any of this in advance, with the exception of getting medical insurance coverage, because that can take some time. Okay, so there's information about registering for kinesiology, taking some of your prerequisite courses at another college, and then risks of physical therapy education and clinical practice. So risks that a PTA may encounter during PTA education as well as clinical practice once licensed include back injuries and musculoskeletal pain associated with lifting and patient handling, which may be limited by using proper body mechanics and lifting techniques. Additional risks inherent in the healthcare industry include exposure to bloodborne pathogens and infectious diseases, respiratory hazards, ergonomic hazards from lifting and repetitive tasks, psychological strain, and workplace violence. Here's additional information pertaining to criminal background checks, including the actual background check procedure that is utilized by all health professions in our division. And then here's information about our psychomotor assessments. So many of you have taken written examinations, which assess the cognitive domain. Once you get into the PTA program, we have competency tests and practical exams, which are how we assess the psychomotor domain. So I encourage you to read that. The next few pages here are the essential functions of a PTA student. So all professions, all jobs basically have a list of essential functions, whether you've seen them or not. And these are the minimum qualities that someone must have in order to be able to do those jobs. So we have these broken up into the cognitive, psychomotor, and affective domain. And I would encourage you to read through this list and make sure that you are adequately prepared and able to fulfill the requirements of this program and this profession. We do have support services for people with differing abilities. Here's that contact information there. We do have some basic computer skill expectations for our students. And the division has a suspension expulsion policy that is specific to the health professions program. So if you have been suspended or expelled from the nursing, MLT, or radiography program, then this is for you. Here's information about financial aid and scholarships available at Mercer, as well as information about Academic Restart. These are courses that are not required, but let's say you're done a semester early and you want to stay in student mode and you would like to continue taking courses, or you have financial aid and must take an extra course. These might be beneficial. We've highlighted medical terminology because that would be at the top of our list. Here are additional support services and their contact information. So we've got support services for differing abilities, tutoring, the Health Professions Success Center, library services, success coaching, counseling services, and student veteran services or student veteran services, and contact information at the end. Okay, we are going back to our website. So the fourth bullet down is the course equivalency page. So if you plan to take some of your prerequisite courses at a different college in the area, before you do that, you should check this page and make sure, let's say that you're going to take a math course at Bucks in Bucks County, Pennsylvania. Don't guess which math course you're taking. You need to take one of these three math courses, Math 103, 120, or 115. because you don't want to waste your time, your effort, and your money taking a course that doesn't equate to a course at Mercer. So I wanted to make sure I pointed that out to you guys. Next bullet is frequently asked questions. I'm not going to read through this, but I'm just letting you know it's there. But I am going to talk about this applicant score worksheet. So this is an example. So when you apply to the PTA program, we don't actually have a paper worksheet like this. It's all in an Excel spreadsheet that calculates everything for us, but this is a nice, easy way for us to talk about it. So of your 8 prerequisite courses, 7 of them must be completed by the time you apply to the PTA program. The one exception is your gen ed course, which is why your gen ed course is not listed in this course here. There's only 7 listed. So we need to make sure that you've taken all the courses, that they're not expired, that you've got the minimum grade. So for this sample student, he took these 7 courses. He earned a B in English 101, a B plus in English 102, an A in Psych 101, a B minus in math, an A minus in his A&P classes, and a B plus in Kines. For every college basically uses the same quality point average, QPA, which is an A is a 4.0, an A minus is a 3.7, a B plus is a 3.4, etc. I've highlighted it in purple here. So his B that he earned in English 101 equates to 3 quality points. And you multiply that by 3 credits, because English 101 is 3 credits, and that equals 9 grade points. So we took all of his grades here, and then we established which quality point value that equates to. We multiply it by the credit hours for each course and ended up with these grade points. Now, for any course that he took at Mercer and earned an A or an A minus, we gave him a bonus point here. So his 14.8 for A&P 1 and 2 actually ends up being a 15.8. And then the final column, we add up all those final grade points and he got an 81.1. We divide that by the total number of credit hours, which is either going to be 23 or 24, depending on whether you took a 3-credit math or a 4-credit math course. So his 81.1 grade points divided by 23 credit hours means that his GPA for these 7 courses only is a 3.53. If we come down to this table in the middle, I highlighted it in pink, the 3.53 equates to 61 points for his applicant score. So his applicant score, oh, I need to update this. I'm reading the wrong one. All right, so let me switch over to the correct document. Okay. So his 3.53 equates to 61 points. And so that goes into his applicant score. So his applicant score is out of 100. 85 possible points are based on this GPA, of which he earned 61 points. And the other 15 points is based on a writing skills assessment. He earned 10. So his total applicant score is a 71 out of 100. And so what happens is on the Excel spreadsheet, every applicant is listed with their total applicant score. And then at the end, we have Excel reorganize it from the highest score to the lowest score. And we accept up to the top 28 students with the highest applicant scores. And those points on the writing skills assessment, I reviewed with you in the information packet. Okay, I'm glad I caught that. Let's go back here to our homepage. Okay, the next link is the PTA program admissions criteria, and I'm going to pull it up from my computer just to make sure that we are looking at the most current one. Okay, so to be eligible to apply for the professional phase, here's the criteria. That you have earned a cumulative GPA of 2.5 or higher. That includes all courses that you've taken that are on your Mercer transcript. That you've completed all prerequisite courses within their listed timeframes. So the only ones that expire is Psych 101 has a 10-year expiration, Anatomy and Physiology 1 and 2 have a 5-year expiration, and Kinesiology has a 5-year expiration. That you've earned the minimum grade required for each prerequisite course. So you need to earn a C+ for your sciences, so your math and your sciences. So your math course, your Anatomy and Physiology 1 and 2, and your Kinesiology. All others are a minimum grade of C. That you've completed all 7 prerequisite courses and they're located on your Mercer transcript. That you've attended this mandatory PTA program information session. That you've submitted a fully completed application prior to the deadline, which includes a writing skills assessment to be taken at the West Windsor Campus Testing Center during the month of April, and that you meet the criteria outlined in the suspension expulsion policy. Okay. Let's go back to the website. And at the very bottom, which we update annually, so this will be updated soon, is a form that we're required to have on our website by our accreditor CAPTE, which just gives more information about finances as it relates to our students. Oh, okay, and then we have a little bullet here for current professional phase learners and alumni, which you guys are not there yet. So I'm going to go back to our PowerPoint so we can resume from there. Okay. Whoops. Okay, so this is how do the clinicals work? So your clinical education courses are assigned by the academic coordinator of clinical education. They are academic courses with their own course objectives. If you have worked in a setting, so you've been a rehab aide or you've doing anything, you've worked in a particular setting, we will not assign you to that setting for a clinical course. These courses are graded by Mercer faculty, not the clinical instructor. So when you go out into these clinical courses, we try to keep you within an hour of your home in terms of commute time. And you'll be assigned either a licensed PT or a PTA who will act as your clinical instructor. And you'll be treating that person's real patients in a clinical environment. These courses are 40 to 45 hours per week for 4, 5, and 6 weeks. And these are all full-time courses. Prior to the start of clinicals, everyone is expected to have met the program requirements, which include medical clearance, attestation of medical insurance coverage, passing a criminal background check, and providing proof of professional liability insurance coverage. Everyone is responsible for providing their own transportation to clinical sites, maintaining a copy of your medical records and having a copy available for each of the 3 sites as needed, purchasing a lab coat with a name tag and a Mercer PTA patch for the sleeve, purchasing medical malpractice insurance, and paying for and making sure your criminal background checks are up to date. So what does it take to realistically succeed in this program? And the answer is you need to have strong organizational skills. If this is not one of your strengths, I would encourage you to start working on this now, to connect with either Professor Talone or I, or a success coach like Ed Griffith, to start to hone your organizational skills. It is helpful to plan ahead if you are able. So no one has been able to work full-time and get through this program because this is a full-time day program. Some of our students who are very good in organization, stress management, and are academically inclined have been able to get through this program working 10 or 15 hours a week. But ideally, you need to have a plan in place so that you don't have to work or work very much during the professional phase so that you can focus your time and attention on succeeding in this program. And you need a strong GPA and strong study habits so that you can really learn the information and not memorize it, which we will talk about more when you get accepted into the professional phase of the program. How realistic is it for someone to work? I just answered that question. It is not realistic to work full-time. What happens after you submit an application to the PTA program? You are going to receive either an acceptance letter or a letter that says you have not been accepted. So if you receive an acceptance letter, here's your to-do list. You're going to accept your seat in the program, provide your section preference for fall courses, pay your tuition bill. You're going to attend a mandatory orientation to the professional phase of the program, which takes place the Friday before classes start in the fall. You're going to submit a criminal background check and check your emails to prepare for that first fall semester. If you've not been accepted into the professional phase of the program, the things you can do are contact me to review how you can strengthen your application score for the following year. And I would say have a backup plan. So what is your backup plan if you don't get accepted? Is it to continue taking courses, to take courses to boost your applicant score? Is it to go back to your job and wait and reapply next year? Is it to apply to a different program? But think about what you might do for that year if you're not accepted this year. I would encourage you not to respond when you're in an emotional state of mind, because then we tend to respond unprofessionally and maybe even inappropriately. And I would also encourage you not to have anyone else contact me on your behalf. So you don't need to have your parent, your spouse, or your PT employer contact me on your behalf. It's best for you to reach out by yourself. What we do after we accept a cohort of students is we update that outcome data table on the PTA program website, but we don't publish and provide any ranking of the applicants. If you have any questions, please feel free to email us at pta@mccc.edu. We wish you the best of luck in this journey.